Hi guys, and welcome back to my channel. I'm pretty nervous about making this video, but I think it's important to be honest. Yeah, that's the whole reason I started this channel, right? 4.5 years ago, I was researching VSG and different weight loss surgeries, and here on YouTube, I was shocked to find such a wide array of experiences already documented about life post weight loss surgery, not just physically, like the recovery and stuff like that, but also about life and how life changes and is impacted by weight loss and these kinds of things. And I was just so grateful to the community for putting that out there, that I just wanted to add my voice to the compendium of voices that was already out there. And so I think in the spirit of that, it's important to remain honest about what life looks like post weight loss surgery. So yeah. I've been seeing the same gynecologist since I was 18, and my gynecologist has seen the ups and downs of my weight journey. And when I saw her a couple of months ago, this year, and I see her once a year, she was concerned about my weight. She had been concerned about my weight in the past, thought weight loss surgery was a great step for me, fully supportive of my low-carb diet. Now she's concerned about my weight again. As a quick recap, if you're new here, hi, welcome. I had a vertical sleeve gastrectomy, or VSG, which is a type of weight loss surgery, back in October of 2016. My high weight was about 270, 265 on the day of surgery. I'm 5'8". I am now 34 years old. I did reach my goal weight of 100 pounds down 14 months post-op. And so like in the first year, basically, and in years 2, 3, and 4, I effectively gained like 10 to 15 pounds each year. And I will put a link below in the description box to my 4-year recap video where I kind of talk about that more in depth if you're interested. But you know, for like the last 6 months at least on this channel, I've been talking a lot about my regain and trying to get rid of it. So, you know, for me, eating the right foods isn't necessarily the problem, right? I've been eating low carb for many, many years now. It works for me. I love it. I think it's great. I don't feel deprived. It doesn't feel like a diet. It's like, it's great. That's not the issue. For me, the issue is portion control, which the sleeve helps with a little bit, especially at the beginning, you know, when you're newly post-op. But as time goes on, you can eat more, and emotional eating, you know, that has really been how I got here. So anyway, I saw my gynecologist, and she's a great doctor, and I wish everyone had a doctor like this, because she is concerned about my whole well-being as a person, not just like the health of my reproductive organs. Like she is interested in me being a healthy person in terms of my blood work, my hormone levels, my moods, my spirit, you know, like she's interested in me being healthy in a very, very complete way, and I love that about her. So even though my blood work this past year came back great, even better than the previous year, my cholesterol came down, my triglycerides came down, blood pressure, like everything is good. My blood sugar is good. I'm no longer diabetic. I was diagnosed as type 2 diabetic back in 2015, which is why my endocrinologist recommended weight loss surgery. Anyway, all of my like tangible health markers are good, except I've gained weight. So she recommended 2 courses of action. She recommended that I see a doctor who specializes in obesity medicine and a therapist. So I went to the obesity medicine doctor and had a conversation with her about my history and how things are looking now. She works a lot with weight loss surgery patients, and she put me on a medication called diethylpropion. And this is a craving suppressant. So it is not an appetite suppressant. And apparently there's different kinds of medications. And because my issue isn't that I'm hungry all the time, my issue is emotional eating, picking, and things like that, she thought this would be a better route. So it's a craving suppressant medication. In fact, it's in the same class of medications that is often prescribed for smoking cessation. Fun fact. And I've also started going to therapy. So a friend of mine recommended her therapist, and I started seeing her, and it has been absolutely life-changing. Because my food issues, as we've long talked about on this channel, are mental, not physical. I'm an emotional eater. Both of my parents were foodies. They taught me the joy of food from a very early age, but also it was very much a Weight Watchers household. My dad was diabetic. My dad died when I was 18 years old. I have all of these like associations with like food and joy, but dieting and so therapy, gosh, I don't know. There's such a stigma around it, right? Because I don't know. I think the stigma around therapy is really, really generational. I think it's an old school mentality to think that you only go to therapy if you're crazy or if there's something wrong with you, and that you should just be tougher or you should be stronger. And I don't know. I think that's such an outdated mindset. And honestly, I would recommend therapy to everyone, whether you think you're struggling or not, whether you think you've had some big life thing or not. I think it's so important for your mental health. I mean, I would say it's kind of like going to the gym. Even if you're already fit and healthy, you continue working out so that you will remain fit and healthy, right? You shouldn't wait until you're super morbidly obese to start working out. If you do, okay, great, but like you continue. And I think similarly with therapy, you hopefully wouldn't wait until you have some like break, hopefully you would go even when you're in a good and healthy mindset so that you can continue to be in a good and healthy mindset and in a good place to address all the things in your life. I don't know. I love it. It's some sessions I go once a week. Some sessions I feel like there's a lot on my mind. There's a lot to talk about. Sometimes going into it, I feel like I don't have anything to say this week, but there's always stuff to talk about, to like peel back the layers and connect the dots. And it's so good because it's an hour that you can just like talk about yourself without feeling selfish. It's different when you talk to a friend, because if a friend is, if you're talking about things that are troubling you to a friend, you kind of always feel this obligation to then hear about what's going on with them, right? Or if you talk about your hopes and dreams or whatever, then you have to hear about what's going on with them. And sometimes that can feel exhausting and you don't want to do it. But going to a therapist, like there's no obligation to hear the other side. They are like trained professionals and interested and kind in hearing your story and putting the pieces together and helping you peel back the layers in a way that is detached. They're not related to you. They have no side. They're just there to help you work through everything, which is just, it's so fantastic. And it's not like she just says like, oh, tell me more. How does that make you feel? How does that make you feel? Like the stereotype, that could be a freaking houseplant. It's different from talking to a plant. It's different from even talking to like your friends or your spouse, because those are people who are like invested in your life and they care about you in a very different way. I mean, the therapist cares about you, but from an outside perspective, they can offer a different point of view. They can offer encouragement. They can encourage you to go down difficult paths in a way maybe your spouse wouldn't want to, or your friends wouldn't want to. So it's just, I'd never been to therapy before, and it's been a really, really fantastic experience. So one of the first things I wanted to talk about with my therapist is like, why do I have these cravings? Why do I succumb to these cravings? Why do I eat almond butter all night long? It's frustrating. Why don't I have the willpower? Why am I not disciplined enough? Why am I not strong enough? And she was like, are you kidding? Look at the rest of your life. You are absolutely disciplined. You absolutely have willpower. You are absolutely strong. There's another layer here. And this just like totally blew my mind, right? Because this is the mantra in our community. We always say like action precedes motivation, and you can't rely on motivation alone. You have to have the willpower to like build the habits, because your motivation is going to leave you and your habits are what will remain. And yes, that's true, but there's another layer there. The next layer is like our programming. It's what we must do as a result of all the things that have happened in our lives up until this point, right? So yes, habits are what we do day to day, but there's this like default programming that if we don't address that on like a deeper mental level, we're always going to go back to that, because that is how we are programmed to respond to things, right? So I can try to build good habits all day long, but if I don't work at like the core of my programming with my emotional eating in this case, my habits are always going to go back to what I'm programmed to do, right? Does that make sense? So like, she explained it in a way much more eloquent than that, but it blew my mind, because like I said, in this community, we always talk about habits over motivation, but we never talk about like how to build those habits other than like brute force, like willpower, just be stronger, and that's where I thought I was deficient. Turns out I'm not. Turns out I'm just programmed a different way because of all the things that have happened in my life that have led me to this point. So I think that in working on that programming, I will be able to change those habits. And I'm just like, I'm so excited about it. And it's like, okay, so I have obesity and I'm not like a victim to that. I mean, it's something that I have, but I don't fall into this like victim mindset of like, oh, well, I'm just obese because of all the things that have happened in my life. Like, this is just my lot in life. It is what it is. I am actively taking control of where that leads me, what my next step looks like, what the future looks like, what my life looks like, by seeking medical attention when I need it and going to therapy. So I really like that even though I can acknowledge that I suffer from obesity, that doesn't mean that I have to be a victim, a helpless victim. You know what I mean? So another thing I have talked with her at length about was like, am I a failure? I had weight loss surgery and I lost all the weight I wanted to lose, but then I regained some. Like, am I a failure for not having allowed that to be the fix in my life? And she was like, no, absolutely not. You have this illness that you are working on curing. Think of like a cancer patient, right? Maybe somebody has a cancer diagnosis and they have a surgery to maybe remove a tumor, but then they need some other medicines or therapies to continue fighting that cancer. It's similar, right? You don't think of that cancer patient as like a moral failure for their initial surgery not having like cured them of cancer completely. You're proud of them and excited for them that they continue their treatments, that they don't throw in the towel, that they continue fighting for their lives. And that's what you're doing here. And I was just like, oh my God, you're so right. Like I had surgery and I still need help. And I think that's actually more normal than we realize. I think that is more normal than we talk about, because yes, that did help me. And I am still at this point 55 or 60 pounds down from where I started. So that's great. But I need more help and I'm getting it. It's not like I need more help and I'm just gonna lay on the couch forever. I'm doing what I need to do to address that. So I think that's just, it's a way we don't often frame things, and because we're so secretive about mental health, but not our physical health, we talk wide open about our physical health. I think it's so important to talk about, the whole person, everything that's happening, because it's all related. They're not two separate things, right? The mind and the body are not two separate things, especially when it comes to things like food and weight and addiction. And, it's all related. So you can't address only one and expect the other one to fix itself. You have to address both. And that's what I'm finally doing. Honestly, I wish I had started therapy immediately when I had weight loss surgery, or even before. And if you are in a position where you can, I would highly, highly recommend it. Even if you don't think like, oh, my life is terrible. Like you don't have to be at that point. You shouldn't wait until you're at that point. It's just so, if you're already healthy, it makes you even healthier. If you're struggling, it helps, it's so good. So I'm taking the medicine kind of as like a stopgap measure, just plugging the hole before the ship sinks over here. But I'm working on addressing the root cause. So the medication, it's been like 3 weeks since I started taking it. The effects are kind of hard to describe. It makes me very thirsty, gives me a little bit of energy. It's not like, it's like maybe just having an extra cup of coffee, you know, so I can still have coffee. I haven't like changed anything else about, you know, whatever. It just makes it easier to not overeat, which is weird. You know, it's a psych med, so it's hard to describe the like physical effect it's having on me, but I still get hungry. I don't like experience repulsion to food or anything like that. I don't feel like extra full for longer. None of that. I think there are other medicines that do those things, but that's not what I needed and that's not what was prescribed to me. This particular medication, it's once a day, it's a time release. It just somehow helps me control my cravings. If I wanted to eat more, I could. I still do sometimes, some days, you know, I'm still working through this and I know it's going to be a long process. But, you know, I think for me personally, and everybody's different, but I'm such a like logic person that when I have emotions, I used to like deal with them with food, you know, and what I'm working on is having logic and emotions and not covering that up with food, enjoying food as a meal, as whatever, but not using it as a tool to like suppress emotion, which is I think what I was very much doing before. So like it's scary and it's exciting because I feel like I feel more, which is weird, you know, like I like cry sometimes, but instead of turning to almond butter, I just cry and then it's over and it's fine. And that I think is such a healthy thing that I'm learning to do. And gosh, it's been a journey and it will continue to be a journey. And I know some of you hate that word, but it's I couldn't recommend therapy highly enough to anyone and everyone out there. Have I said that enough times? So yeah, I mean, it's a combination. It's the medicine, it's the therapy. You know, another thing I've talked to her about that I'm still kind of working through is figuring out my why. As I've told you guys here on this channel, you know, my initial why was to no longer be diabetic. And now that I am no longer diabetic, what is my why? Sure, long-term health and things like that. But I think I'm slowly getting there. And it's just so good to have somebody to offer a different perspective, to push back, to make you think about hard things that sometimes you don't want to think about, and to show you that it's okay. You know, like sometimes it's scary to go down certain rabbit holes, but then you do and you come out the other side and it's totally fine and you survived and actually you feel better for it. And it's just, it's been a really great process. So I think that these two things together will absolutely help me address my regain. And I know that therapy is not always accessible for everyone. I know it's expensive. For me, and my insurance only covers it partially. But I would encourage you to see what resources are out there. I know there are a lot of free resources as well, but if you can find someone, I would 10 out of 10 recommend it. It's worth the money. Think about all the things you spend money on that you probably don't need. Yeah. This has been great. So this was the big scary thing that I wanted to tell you. And I just want to thank you again for always being so kind and so supportive, and for being here with me on this journey. And I will continue talking about this, and I think it's important to destigmatize it. And if you have any questions at all, please leave them below. I'm happy to chat in the comments or address whatever it is in the next video. So thank you so much for watching, and I'll talk to you soon.